So, marijuana use in pregnancy has been on the rise. I know it in a certain demographic of patient, typically on the younger side, um, it's almost like ubiquitous, meaning like, I mean, I don't, it's hard to even let it register because it's so common as a substance that people use. And hello, everyone. Can everyone hear me? Hello, can everyone hear me? We're just gonna wait a few moments. The rest of my team is on their way. Oh, perfect, Aisha. Aisha, I'm gonna add you as a co-host. I don't see the other two. Aisha, I added you as a co-host so we can get started. Lucretia, I see that you said you're in. Let me see. I'm sending you the invitation. So hopefully we're not having that same issue as last week. I invited both of you, Aisha and Lucretia. If you can't see it, let me know. Okay, I'm inviting you guys again. You guys can talk to me on Slack if you're not getting these invitations. So sorry, everyone. We're having few technical difficulties. I guess the chat is keeps kicking them out. Hopefully they'll get settled in 1 second and then we'll get started. I hope everyone's having a wonderful day. Hello. How are you? I'm seeing other members of our team logging on. All right. I'm gonna add you again, Aisha. Okay. And I need you to jump on and then we can figure out how to get Lucretia on. So while we're waiting, if people have questions that they want to ask about the topic, go ahead and throw them into the chat, and we'll get started. We have questions that we have prepared. If nobody has anything kind of right off the bat. So, Lucretia, I'm sending you an invite to log in. I've sent it a couple times. Yep, I've added you a couple times. It's saying it's waiting for you to accept the invite. Lucretia, if you can hear me. I actually don't see you in the room, Lucretia. Okay, so can you add me? I apologize. We're talking on Slack. I'm sending you an invite. Can you accept the invite? Okay, I'm going to send you the invite again. You have to accept it pretty quickly. So I'm sending you the invite. So I sent it. Interesting. I don't know if I don't know if going live on Substack is going to work because we're always seem to have these issues. I don't know what else I can do on my end. So I have added you as a co-host. I'm adding Aisha as a co-host. I apologize, everyone. Aisha, are you able to accept my invite? All right. So fortunately, we're going to do this a little bit more like a lecture, which I wanted to avoid. All right. So, all right, we're going to try inviting them again. Precious, I can't add you as how you're logged in now, because you're not logged in as a member of our like it's not letting me actually add you. Um, Try logging into with your DA account. All right, everyone. So we're gonna go ahead and get started. Hopefully, someone will figure out something. So marijuana use in pregnancy has been on the rise. I know it in a certain demographic of patient, typically on the younger side. Um, it's almost like ubiquitous, meaning like I mean, I don't. It's hard to even let it register because it's so common as as a substance that people use. And one of the things that, alarm me, and one of the reasons that we wanted to do this live today is we wanted to take the opportunity to talk to you all about what we're seeing, what the data says, and answer any questions that you might have. There are a lot of reasons that people use marijuana in pregnancy. Um, there's been kind of a cultural uptick. Um, so with legalization, there's just more. There's been kind of a cultural uptick. Um, so with legalization, there's just more. There's been kind of a cultural